Hi friends, I am here with another video. Thank you very much for your support, and if you are watching my channel first time, please subscribe, like and share it. Today I am here with a letter to psychiatrist. So let's see how we can do this letter. So we have to see the instructions first. This is a writing subtest for nursing and time allowed is the reading time 5 minutes. So as you know, I have mentioned in other videos, the reading during reading time you cannot take any pen or pencil in your hand. So you should use that time wisely to plan what all information how to include in this letter and according to the reader. Then with this writing time of 40 minutes, if you plan very well during this 5 minutes time, you can do it within 30 minutes. So let's look in detail. First we can see our position. You are the registered nurse in the emergency department at Riverview Hospital, Queensland. Miss Monica Rose is a patient in your care. Then let's go to the notes. The name is Miss Monica Rose, age is 26, and the date of admission is mentioned on 3/5/2019. Don't forget to read the subheadings at the left side, so you will get what all information we have to include in this letter. Then before reading all this relevant information, we have to see who is our reader. I have already mentioned in this one, we are going to write to a psychiatrist. So go to writing task. Using the information given in the case notes, write a letter of referral to Dr. Godwin Roderick, psychiatrist, Southampton Medical Center, 478 Willow Street, Queensland 8987. Then we can think what all information a psychiatrist needs from this letter. So let's read from beginning. So she was presented with complaints. What complaints? And what is BIBA? Anybody has idea what is BIBA? I've done one video before regarding the abbreviations. So it's better to practice abbreviations because if you don't know what is BIBA like these abbreviations, it's very hard to write the letter clearly and it might deviate from the information. So we have to practice a lot abbreviations and we cannot write any abbreviations in the letter. So I will explain this. BIBA means brought in by ambulance to hospital in ED means emergency department at 11:30 p.m. May 3 with complaints of slurred speech, headache, confusion, diaphoresis, consumption of 20 tablets, paracetamol on taking 1 bottle of wine. So we got the idea how she is admitted was the reason because of the overdose of paracetamol. Then on admission, what all things they have found. She was responsive and constricted pupils and low BP and weak pulse. Then to the assessment section. She vomited twice, drowsy, pale, vital signs but looks normal. Then saturation was normal also. Then she's respond to verbal commands. That means she is conscious and GCS was normal. What is GCS? Especially for those fresh nurses, it is hard to understand the abbreviations. So GCS means Glasgow Coma Scale, which is used to assess the neurological status of the patients. Okay. It may be a lengthy video, but I can assure you that if you follow this letter explanation without skipping the video, you will get a clear picture how to write a letter to psychiatrist and even the other receivers, the way how we should write. I'm explaining in detail. That's why it may be a lengthy video, but just try to focus on this one. It will be beneficial for you. So let's go to the medical history. What do you think? Which all information we have to include in this letter? She had a fractured knee at age 5. Now she is 26 years, so no need to mention these things. and father died, no drug overdose, no drug allergies. If there is something allergic, we have to inform. Otherwise, no need to include. No history of mental illness or medical issues. Or if it's the receiver is a pharmacist, like that, we have to inform about these allergies. Then takes alcohol. Should we know? He know. Is she taking alcohol at parties? And recently uninterested. Yeah, this is very important for the psychiatrist because she has mental issues, that behavioral changes, so we have to include in this letter. Then let's go to the family history. She is single, lives with mother employed as a manager, private firm until retirement age 65. Then hobbies badminton, football, recently not interested. So this is important. Regarding her mother, no need to mention. Then it comes sister Natalie. Should we inform him? No need. Then go to the social history. She was an accountant, trainee at Lowers. No need to inform him what he will do with this one. Then go to nursing management. She was admitted in the emergency department for observation. Then the blood tests, X-ray, everything was done, and vitals and GCS was assessed. Then she has received antidote. What is the antidote of paracetamol? That is N-acetylcysteine. So they have given that N-acetylcysteine in NS, that means normal saline. So we have to inform them what is the management we have done. Then let's look on 5th May 2019 what happened. It shows the improvements in this section. Patient conscious still appears, but she appears pale and feel drowsy. Vomiting subside, and that's why the IV fluid has stopped. Then she tolerates oral liquid, signs of diet, and shows disinterested in life. So still, even though her conditions has improved, she still shows disinterested in her life. That's why they want to refer her to, and she has suicidal attempt also. That is related to her behavioral issues. So that's why they were referring her to a psychiatrist. Then what is the discharge plan? Plan for discharge tomorrow if her investigations reports are normal. If it's abnormal, she will not be discharged. So we have to inform him that one. Review with the toxicologist because she had consumed lot of, that means 20 paracetamol, that is overdose. So they have to refer to him. Then referral to psychiatrist or P clinic for assessment and ongoing care. So I think you got an idea why we are referring her to psychiatrist. It is very important. Do not change the gender. Sometimes we will start to write on the, it will be female patient, but once we return and reach at the last portion, maybe it can change to him, he. So always make sure you do not change the gender. It can lose your marks. So let's see how we can write the introduction. Before that, same like all letters, first we have to write the address and the receiver's name. So here is Dr. Godwin Roderick, psychiatrist. Or don't forget to mention, even though it's not given psychiatrist in his address, you have to mention his position. Psychiatrist, Southampton Medical Center. Then we can just write Queensland. No need to write all address. 4 lines is enough. Then we have to mention the date. Usually the date, discharge date, what we are writing, the exam date. But here it's mentioned the last date is 5/5/2019. So you can write on that date here. So then the salutation comes, Dear Dr. Roderick. We always use the surname to, then we have to put comma. That is, we should know where we have to put the comma. Then the reference is regarding Miss Monica Rose. And even though they did not mention any Miss or Mrs., we have to see if she is married. Here she is single, that's why we should use only Miss Monica Rose, comma, age 26. If it's date of birth, we can use date of birth. And recently when there was a live with Miss Rebecca from the OET, So she has mentioned it's better to use the date of birth rather than the age. And if there is no age mentioned, you don't want to assume the age and no need to calculate. Just write the date of birth. So let's look how to do the introduction. There are several ways we can use to make the introduction. So let's see how. Then this is a referral to psychiatrist. So we can write, I'm writing to refer Miss Monica Rose. And from the official occupational site, it was mentioned by Miss Rebecca before. In the introduction, we can use the full name. Before it was only we were using surname, but now they told we can, in the introduction only we can use the full name. So I'm writing to refer Miss Monica Rose, who is recovering from overdose of paracetamol. You can also write who has been diagnosed with paracetamol overdose, but it's better to write who is recovering. She's already recovering because her condition has improved and it's already 2 days. So we have to mention that one. Then what is our request? Request further assessment and ongoing care. It's already mentioned in the discharge plan. Why she wants a psychiatry referral for the further assessment and ongoing care? Because she shows disinterest towards her life. So it's well clear for the receiver why we are referring her to the psychiatrist. Then we will go to the present complaints, why she was hospitalized. So we can mention Miss Rose was brought to the emergency department. So please be careful when you are writing. If she presented herself, she presented to the, before the hospital, no need to mention the, or it is mentioned the specific hospital name. You can write she presented to hospital. Never write was presented. But if it's emergency department, you should mention the emergency department. So here she was brought to the, it is mentioned brought in by ambulance. So you can write Miss Rose was brought to the emergency department on 3rd May. We can write 03 May 2019. What's the complaints? Due to or with the complaints of, or with, like we can write like that. Due to slurred speech, comma, headache, comma, confusion and vomiting. Also she had vomited twice. So we can write and vomiting after consumption of 20 tablets of paracetamol with a bottle of wine. So we can mention how many tablets. It's very important. Then on assessment, what they found, her vital signs showed remarkable changes. Therefore, in order to connect, so we should tell like a story. So it is clear. As they found, there is remarkable changes in her vital signs. Therefore, comma, she was treated with antidote N-acetylcysteine in normal saline. So the treatment has completed. Then what we have to mention in, leave a blank line, then go to watch her progress during this hospitalization. We can write during hospitalization or on her subsequent days, on the following days, or we can write currently what she shows. So we can write currently, comma, Miss Rose, apostrophe S, Miss Rose condition has improved as evidenced by, there is some evidence is showing how her condition has improved as evidenced by decrease in frequency of vomiting. It's mentioned there, her vomiting subsided. Then what are all things? Vomiting, however, that is a positive thing, her vomiting has subsided, but there is some negative. However, she appears pale and drowsy. See, we are using however to show them some contradicting information. There was some positive improvement in her condition, but still she looks pale and drowsy. We should inform them. Recently, she tolerates oral fluids and soft diet. That is a positive sign also. That means her condition has improved. Please note, she will be discharged tomorrow if her investigation reports are normal, because it's mentioned like that. So we have to inform him that if her reports are normal only, she will be discharged tomorrow. So we can use polite way, please note. It's so important, if you are writing please note, after that you have to use comma, and if it is please note that means you don't want to use comma. So you should know when you have to use the comma. I will do a video later regarding the usage of comma in OET writing. So next, go to the social history. It was completed what all things was done in the hospital, and if any medical history. Here no, this all medical history is irrelevant. He doesn't want to know. So only the social history we have to mention. So it's here. Miss Rose is a single. Miss Rose is single who lives with her mother. And then we can write, recently she has been showing uninterest in activities. We can mention if we want in activities such as badminton, football. But otherwise also it's okay. Just write in activities and become socially withdrawn, because she's not showing any interest in activities and she's not going outside sitting. See, visit. So that way we can write also she's socially withdrawn. She's not showing any interest. So he got a clear picture about Miss Rose. Then we can write the recommendation, what he has to do. So considering the above, your effective consultation, or we can use the word evaluation, and psychological support, what the psychiatrist is providing, psychological support would be highly beneficial for Miss Rose. Then we can use the conclusion letter. Please do not hesitate to contact me if you have any queries regarding Miss Rose. Then as his name is mentioned here, Dr. Godwin Roderick, we can use yours sincerely, comma, registered nurse. It is mentioned there. If it is mentioned charge nurse, you have to write charge nurse, your position. So when you are writing yours sincerely or faithfully, make sure the Y is capital but the S is small letter, and don't forget to write comma. I think you got an awareness how to write a letter. And if the important thing is that unlike you are writing to a community health nurse, limited informations are we are using for other receivers. So you can concise the letter and you can write in within one page or just at the back of second page, only one or two lines. Don't elaborate the letter so it can reduce your mark. I think it is effective for you, and if you like it, just share it and subscribe my channel and support me. Thank you very much. I will come with another video with another receiver. Thank you.